I love this question, and the answer is it really depends on how your capsular contracture was treated. So a long time ago, the study showed that the recurrence rate of capsular contracture was really high, like really, really high, but that's not really the case nowadays. The current literature says anywhere from I think it's 7 to 25% recurrence rates, but in my experience, it's much lower than that. So I'm super passionate about managing capsular contractures. I'm actually a PI on an FDA trial right now. So if you have a contracture and you're interested, shoot me a DM. But here's the things that I think are really important when you're managing a contracture to minimize the chance that it comes back. So first of all, I think it's really important that you rule out biofilm, which is a major contributor to contractures. So biofilm is a low-grade subclinical infection. It often doesn't grow well on a culture, so I prefer to check a PCR test at the time of surgery. Because the results don't come back immediately, I treat my patients with antibiotics until the results come back that cover the common pathogens that I see in my practice causing contracture. And then of course we tailor the antibiotics once the testing comes back. Now the next thing that I think is really important is removing the entire capsule. And I know there's some controversy about this, and people will say there's literature that shows neo-pocket, total, anterior capsulectomy all have the same results. The recurrence rates in all those studies are higher than I see in my practice. So I personally take the whole capsule out always. I think it's always possible. I know people will tell you all kinds of crazy things about horrible complications. I find that I'm good at it. I do it all the time, and I just prefer to take all of the abnormal scar tissue out. That's my preference as someone who does a lot of this surgery. After that, I do a pulse lavage, which you can think of as like a medical power wash to further reduce bacterial count. We're assuming there might be a biofilm there. And then after this, we change our gloves, we get new instruments, and we go to reconstructing you. And we reconstruct you, of course, with a brand new implant. You can't use the old one because it might have a biofilm, right? So a brand new implant. And then I'm also a big believer in scaffolding. So I think dermal matrix or mesh, I think that they both work very well when they're used properly. But I am a strong believer that those things are wonderful and should be liberally used to prevent contracture recurrence. So here's my little soapbox about contractures. So you will see people telling you that contractures don't need to be treated. They just come back, leave them alone. I don't agree with that, and it makes me twitchy when people say that. So first of all, you deserve to have soft, non-painful breasts. You deserve to feel comfortable hugging people. You deserve not to have pain. It can be fixed. I hate that patients have to deal with that. Second, and this is a very small concern, but it's a big concern in some ways, there has been a rare cancer associated with chronic contractures now called BIA-SCC. And for that reason too, I think we should not let these things go. You deserve to be comfortable, you deserve to not be in pain, and it is a small risk for that type of cancer. And always remember, even if you have cosmetically placed implants, sometimes insurance will cover a portion of your surgery. So they won't typically replace the implant or cover the scaffolding, but they often will kick in for the implant removal and the capsulectomy portion of your surgery. So I think it's worth asking your plastic surgeon if that's a possibility, because it can make it less expensive for you. And then finally, I'll throw out some adjunctive therapies that people recommend after contracture therapy that I don't use in my practice. So the first thing is Aspen therapy, which is ultrasound. No good evidence it works. The photos are shenanigans. Every time they send me a thing, I just roll my eyes. They show photos right after surgery where things are high and tight, and then a few months later when it's relaxed. That happens without Aspen. I don't think it's worth the money, personally. If I see a good study that shows it is, maybe I'll change my mind, but as of now, no. And then the oral medicines, vitamin E and Singulair, a lot of people use these. I don't think it's necessarily wrong, but I don't think there's good data that they do much of anything. But if you are really worried, I don't think it's wrong to give it a go. So again, if you have a capsular contracture and you're interested in the clinical trial, you can DM me for information, or you can go to clinicaltrials.gov and you can see the trial there. It's called the STANCE trial, and that's just a quick 4 minutes on capsular contracture.